Hi, welcome to Let's Update Language Academy speaking session. So this time OET ഒരു സ്പീക്കിംഗ് സെഷനുമായിട്ട് യൂഷ്വലി ഞാൻ ലെറ്റ്സ് അപ്ഡേറ്റ് ഉള്ള ട്രെയിനേഴ്സും ഞങ്ങളാണ് വരുന്നതെങ്കിൽ ഈ വട്ടം ഒരു പ്രത്യേകതയുണ്ട്. ഐ ഹാവ് വൺ ഓഫ് അവർ സ്റ്റുഡൻസ് വിത്ത് അസ് ആൻഡ് വി യൂഷ്വലി ഡൂ ദിസ്. ഇപ്പോൾ കുറച്ച് നാളായി അങ്ങനെ ചെയ്തിട്ട്. അപ്പം now the Let's Update Language Academy is filled with very young and vibrant students. So we thought, why not utilize them for the speaking sessions? And of course, they are speaking very well. So I'll introduce my student. This is
Rosemary AB, and I have completed my BSc Nursing degree from Westport College of Nursing, Thrissur.
okay, Rosemary. So I hope you are ready.
Yes, ma'am.
It's always good to have a session like this before your examination, isn't it?
Yes, ma'am.
Okay, fine. So shall we start?
Yes, ma'am.
Okay, so we'll be starting with all the instructions that you usually see in the examination, and then gradually we'll move to the card. Okay?
Yes.
We'll be dealing only one card this time, and we'll be definitely coming up with more cards. Okay? All right. So we're going to start. This is a recording for occupational English test held in Let's Update Language Academy on 15th July 2024. The candidate name is Rosemary AB. The candidate number is Z428901. The examiner name is Priyanka Prathas and the examiner number is 88005. The role play number is 2. The profession is nursing. Good afternoon. My name is Priyanka Prathas. Can you say your full name for the record, please?
Yes, ma'am. My name is Rosemary AB.
Okay. And what is your candidate number, please?
My candidate number is Z428901.
Okay. You're taking this test as a nurse. Is that right?
Yes, ma'am.
Thank you. And can I see your identification document, please? Okay. So I'm going to work with you for this test. There'll be warm-up questions followed by 2 role plays. Remember, this is a test of English, not of your professional knowledge. Please speak naturally. Do you have any questions about this?
No, ma'am.
Okay. I'll take the position of a patient or perhaps a relative. You'll take your professional role. This is to check your efficiency to communicate effectively with patients. Use as much of your role play as possible. Do you have any questions?
No, ma'am.
Okay. The warm-up questions are not assessed. It is a chance for us to get used to each other's voices. We'll just talk for about 2 to 3 minutes. I would like you to tell me about your professional background. So tell me, how long have you been a nurse?
Yes, ma'am. Thank you for the question. And I haven't worked as a nurse yet. I have just completed my BSc Nursing degree. And in my professional career, I'm going to work as a nurse after my OET exams.
Okay, good. Why did you decide to become a nurse?
So, ma'am, nursing is a profession which requires a lot of efforts, as well as there is some qualities which is required to be a nurse. And I have been living surrounding many nurses in my family itself, so I have heard lots of stories from their side also. That means they are helping others to do good, and as well as their health is being promoted by providing adequate care to them. So I think I feel very much motivated on hearing all that stories, as well as there are some qualities such as good communication skills and decision making skills and providing and serving people. So I think I possess these qualities in my life also, so I decided to become a nurse.
Right. Let's start the role play now. You have up to 3 minutes to prepare. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there is anything you're not sure about, and you can take notes on the role play if you want. You can look at the card during the test, but you must return it to me at the end of the test. This is the information for the first role play, and it's role play number 2 for the profession nursing. So please start preparing now.
Thank you. Good morning.
Good morning.
I'm Rosemary AB, and I'll be the attending nurse today for you.
Okay.
And may I know the reason behind your visit? From your case file, I came to know that you're here for the eczema management advice as per the referral by the doctor. Am I right?
Yes.
So could you please tell me what do you know regarding the condition eczema?
My doctor has actually explained me what eczema is, but to be frank, I was shocked to listen to him that I'm diagnosed with eczema, so I don't remember exactly what it is.
I can sense your situation, Ms. Priyanka. Please don't be worried on hearing this. This condition is completely manageable. So I'm very glad to provide you some information regarding this condition. This is a chronic condition. That means it may have a prolonged period or it may take a short time for recovery. So please don't be worried on hearing that too. This is just an inflammatory condition which may cause itchy, dry, or cracked skin. So these are some symptoms which you may experience on having this condition. And the onset, that means this may appear out of nowhere. That means on a sudden day, it may present some symptoms on you. And it is very much common in adolescence or early adulthood. But the exact cause of this condition is very much unknown. That means no one is able to recognize the correct cause which is lying behind this condition. Are we on the same page, Ms. Priyanka?
Actually, yes, but I'm really embarrassed about the appearance of my skin. And can I ask you a question like, is there any cure for eczema?
Yeah, I can sense your feeling, Ms. Priyanka. Don't be worried. We are here to help you. And here in this condition, as I already mentioned, there is no complete cure. But don't be worried. This is very much manageable. That means on applying correct ointments, lotions, or taking proper treatment, it is very much manageable. And the symptoms may reside after a short period of time.
Yes.
So please don't be worried on hearing that. But I can provide you some self-care measures or self-care ideas that may help you very much.
Okay.
May I?
Yeah, sure.
Okay, the first one is regular bathing and moisturizing yourself. That means you can apply any kind of moisturizing lotions, which may be very much beneficial for you. As well as along with that, you can use non-perfumed soaps, and please avoid scratching at your skin area which the condition is affected with.
Okay.
I think I have made myself clear, Ms. Priyanka.
Yes, that is pretty clear. So, I have noticed that today it was in a worse situation, but sometimes it is okay. I don't understand it's why.
Okay, Ms. Priyanka, I have noted that. And in this condition, this means flare-ups are very much normal. That means some conditions or some triggers are there which may flare up the condition. As well as if the triggers is not there, the symptoms may subside.
Okay.
So this is common in this condition. So first and primary thing which you can do is to find out the triggers which may affect your skin.
Okay.
So the major things which may affect is allergens, as well as any kind of stress and irritants. So these are some of the triggers which may flare up your condition.
Okay.
So if you are finding it out and avoiding this triggers, then it can help you to prevent your further flare-ups.
All right. Okay, I got an idea about that. Unfortunately, my doctor didn't prescribe any cream for me. I expected that. So, if you don't mind, could you prescribe some cream for me?
I can understand your situation, Ms. Priyanka. I know that it is affecting you very much, this situation or this condition. So in this case, I can't prescribe you currently with any kind of creams or lotions because it's not my role. It's beyond my scope. That's a doctor's decision. He is the right person to provide you with adequate treatment and measures which can subside your symptoms. So I'm so sorry I have nothing to do with that right now.
Okay.
So as of next step, I can tell you that I have already mentioned you regarding the self-care advices or self-care measures which you can do by yourself.
Yes.
Please try it at home and just monitor whether your symptoms is flaring up or it is subsiding.
Okay.
Later on, if your symptoms is not subsiding and if you are having further itching or cracked skin, please don't hesitate to take the medical advice. You can come back here at any time.
Okay.
So please monitor yourself and try your self-care measures that may help you very well, I think so. Yeah. So please do that, and you can do it by yourself at your home, and it may help you very well. Okay. So try it out and come back if your symptoms is not subsiding.
Okay, sure. I'll try the self-care advice and I'll return if there is no improvement. Okay, thank you so much for your words.
Thank you, Ms. Priyanka.
Thank you. So that was the end of the speaking. So now you can relax. All right. So you did a great job.
Thank you.
Of course, I should say. And I do not have many mistakes to notify or to give you an advice on. But then few things let's look into the criteria of speaking, isn't it? So we have linguistic criteria as well as a clinical criteria. Most of the students lose marks in the linguistic criteria. The clinical criteria is almost covered when we go through the text. Okay, textilude പോകുമ്പോൾ തന്നെ നമ്മുടെ clinical side പലതും cover up ആവുകയാണ്. And when I look into your linguistic criteria, language criteria നോക്കാൻ നേരത്തെ എനിക്ക് much mistakes ഒന്നും കണ്ടുപിടിക്കാനായിട്ട് പറ്റിയിട്ടില്ല. That's a very good thing. And in fact, more than that, appropriateness of language ആയിക്കൊള്ളട്ടെ, intelligibility ആയിക്കൊള്ളട്ടെ, grammar ആയിക്കൊള്ളട്ടെ. So ഈ ഏരിയയിലൊന്നും എടുത്തു പറയത്തക്ക mistakes ഒന്നും തന്നെ വന്നിട്ടില്ല. And this condition come out of nowhere. That was a wonderful usage. Idiomatic expressions ഒക്കെ use ചെയ്തിട്ടുണ്ട്. That's a good thing that you have done. And one, what to say, clinical mistake which I have noticed is ക്ലിനിക്കൽ ക്രൈറ്റീരിയയുടെ അണ്ടറിൽ വരുന്നതല്ല, എന്നാലും ദിസ് വിൽ റിക്കവർ എന്ന് സംവെയർ എൻ്റെ അടുത്ത് പറഞ്ഞതുപോലെ എനിക്ക് തോന്നി. ഓക്കെ, during the conversation, but at the same time you said that there is no cure for this. Okay, so this can be managed എന്നായിരിക്കും ഉദ്ദേശിച്ചത്, but since this is a medical thing, that is not going to affect you. കാരണം മെഡിക്കൽ നോളജ് അല്ല ഇവിടെ നോക്കുന്നതെന്ന് നമ്മുടെ സ്പീക്കിങ്ങിന്റെ ഇനിഷ്യൽ സെഷനിൽ ആ ഒരു ഇൻസ്ട്രക്ഷനിൽ തന്നെ പറയുന്നുണ്ട്. സോ ദർ ഇസ്, ബട്ട് സ്റ്റിൽ ഐ ഹവ് ജസ്റ്റ് നോട്ടിഫൈഡ് ഇറ്റ്. ഓക്കെ, ആൻഡ് യുവർ എക്സ്പ്ലനേഷൻസ് വേർ അത്യാവശ്യം ക്ലിയർ ആയിട്ടും എനിക്ക് വീണ്ടും സമ്മറൈസ് ചെയ്ത് തരുന്ന രീതിയിലൊക്കെ ആയിരുന്നു. ആൻഡ് യു കൺസിഡേർഡ് മീ സോ വെൽ. ലൈക്ക് ഇനി ക്ലിനിക്കൽ ക്രൈറ്റീരിയയിലോട്ട് വരാൻ നേരത്ത് ഗിവിങ് ഇൻഫർമേഷൻ്റെ കാര്യത്തിലായാലും ഗ്യാദറിങ് ഇൻഫർമേഷൻ്റെ കാര്യത്തിലായാലും അണ്ടർസ്റ്റാൻഡിങ് ദ പെർസ്പെക്റ്റീവ് ഓഫ് ദ പേഷ്യൻറ്റ്. ലൈക്ക് ഐ സെഡ് ദറ്റ് ഐ വാസ് ഷോക്ക്ഡ്, യു അണ്ടർസ്റ്റുഡ് ആൻഡ് യു ട്രൈ ടു കൺസോൾവ് മീ, ആൻഡ് ഐ സെഡ് ദറ്റ് ഐ വാസ് എംബാരസ്ഡ്. അപ്പോഴൊക്കെ കൃത്യമായിട്ട് എന്നെ പ്രോപ്പറായിട്ട് എന്നെ കൺസിഡർ ചെയ്തിരുന്നു, which is again a good thing. So overall I'm impressed with your speaking. അപ്പോൾ ഓടിപ്പോയി എക്സാം എഴുതിക്കുന്നു സ്പീക്കിങ്ങിൻ്റെ കാര്യത്തിൽ. Okay, and sometimes this is a good card that you could perform well. എല്ലാ കാർഡും നമുക്ക് ഓവർ കോൺഫിഡൻസും ആവാൻ പാടില്ല അല്ലേ, എല്ലാ കാർഡും നമുക്ക് ഒരുപോലെ വരണമെന്നില്ല. So keep on practicing. So hope we had a good session. നല്ലൊരു സ്പീക്കിംഗ് സെഷൻ ആണ് നിങ്ങൾക്ക് വേണ്ടി നമുക്ക് കൊണ്ടുവരാൻ പറ്റിയെന്ന് വിശ്വസിക്കുന്നു. സോ അങ്ങനെയാണെങ്കിൽ യു ക്യാൻ കമന്റ് ബിലോ. താങ്ക് യു റോസ്മേരി.
താങ്ക് യു മാം.
താങ്ക് യു.